This was shortly after we first met.
Susan Cook is able to focus on happy memories of life with her husband, Tony, because of the way he died.
It was a beautiful way to go. It really was. He was at peace.
After a lengthy battle with brain cancer, Tony chose medical assistance in dying. It became legal in Canada in 2016, but as of last week, new requests won't be an option in Nova Scotia for 30 days.
It would be unethical for me to offer a service to somebody that I couldn't provide them.
The clinical lead for the MAID program says he paused new referrals to clear the backlog of several dozen people already waiting. He also says he could use more resources.
We don't hire MAID physicians or MAID nurse practitioners. These people are all professionals who have full-time jobs, most of them, who do MAID assessments and provisions in their off time.
In Nova Scotia, demand has increased more than tenfold since MAID was legalized. It's partially because in March, the law changed such that more people are now eligible. There are also extra pressures on the system due to the pandemic, all of it forcing the pause.
30 days is a very, very long time for people who are at the end of their life.
This advocate says she understands the province's decision, but is still concerned.
In a couple of cases that I've seen, it wouldn't have worked at all because the person would have become incompetent before they could make the request. And once you're incompetent, you can't make the request.
And that's the model boat that he built.
Susan Cook is grateful her husband didn't have to wait.
He was counting the days. So for him to have to wait for another month or so, it would have been a really terrible thing.
She hopes health officials catch up quickly so others aren't robbed of the peaceful death her husband chose. Kayla Hounsell, CBC News, Halifax.